the government held true to their word this afternoon and they refused to discuss pay with me in the room this afternoon.
So is part of you wondering why they held those talks in the first place? Because you made it very clear the pay had to be on the table before you would go along and talk.
Look, I have made it very clear that if they want to avert the strike on Thursday and on the 20th of December and moving forward, we needed to get into a room with myself to discuss pay or with conciliation through ACAS. I went into that room today with hopes, obviously, and came out with not one single brown penny for our nursing staff.
OK, but the hopes and a preparation to compromise a little, perhaps? I
said, let's open the discussions today, let's open the negotiations, but there's no point in me getting into that because the Secretary of State made it very clear. The books are closed, they've accepted PRB, we haven't. Our nursing staff haven't. The largest mandate that any trade union has had in a very long time, and he refused to listen.
This is PRB, the pay review
Absolutely.
body, which the government says is responsible for deciding the size of the rise.
It is, and we have provided evidence year on year to the pay review body. That evidence gets ignored. And, you know, let's be clear, the pay review body is not independent. The pay review body remit is set by government. And those letters are a matter of record on their website on what they say. They tell the PRB it's their pay round. They tell them basically what they should be providing. And then the system, the organisations that employ our nurses were told this year to budget for 3%. And quelle surprise, what does PRB offer? 3%. So we are going round in circles. I did a lot of talking, reminding the Secretary of State about the crisis that we are in. It was, for me, I think he showed total belligerence to the nursing profession this afternoon. He closed his books and they walked away, and they've turned their back on our nursing profession.
Well, you say, I mean, it's a strong word, belligerence. What did he say? What precisely did he discuss? How long were you in there for?
We were in for about half an hour.
Right. So, Secretary of State, I mean, how did he display that belligerence?
I think what I've said is that I did most of the talking. And there was very little talking coming from the other side of the table, except to keep repeating to me that he has accepted the independent pay review body position for this year, and there will be no more money put on the table. Of course, he restated the economic position of the country. He restated inflation, and we kept going round the circle and talking about the same things. Every time I brought the Secretary of State back to say, please, we need to address pay if we are to avert this strike happening on Thursday. I need to have a discussion with you about pay. And that was not forthcoming.
Does that not cut any ice with you or your members, that economic argument about inflation and the state of the nation's finances?
Of course it does. Of course it does. But let's not forget that nurses' pay has dropped by 20% in the last decade. In fact, what they're looking for is pay restoration, that money back into their pockets so that they can live their lives as well and be actually able to look after their children, pay their utility bills and be able to pay transport to get to their work. They're not asking for their pockets to be lined with gold, never have and never will. They're not a greedy profession, I keep saying it, but we need to have pay addressed for those nurses. They are living beneath the breadline. They can no longer afford to continue to work in our profession, and I think that's a sad indictment. Those people are leaving in droves to find jobs elsewhere, and we cannot afford to lose one single nurse out of our profession, nor can our patients afford to lose them.
And just in terms of what happens this week, we know that so many of your members, when they go on strike this week, are going to do so with a heavy heart because of the very nature of their calling. But do you think that belligerence you described there from the Secretary of State will stiffen resolve amongst the membership?
I think our nursing staff are in such a place. I never thought in all of my nursing career, 43 years now, that, and in the 106-year history of this great college, that we would have the strength of mandate for strike action amongst our profession. In fact, if you look at the history of our college, the majority of our nurses all joined the college because we had a no-strike position within the college, and now we're finding the strongest mandate ever. So I think that tells its own story. Our profession is struggling big time. They're struggling to look after their patients. When they come out at night and come off shift, they are worrying about the work and the care that they've left undone. And then they get up worrying about what's going to face them the next day with the 50,000 vacant posts that are within the system in England alone, and the same throughout the other countries. So it's no way to treat the profession, no way to treat patients, those 7.2 million people languishing on waiting lists that we want to treat, and they'll not be treated unless we address the issues with nursing.
And with a strike, those waiting lists can only get a bit longer. So it seems the 15th, this Thursday, is baked in, given what happened this evening. Any hope, though, to avert the 20th and maybe subsequent strikes?
Look, as a nurse, I always live in hope, and our nursing staff will live in hope. But we've been left out in the cold by the Secretary of State. And where do our nurses want to be on the 15th and the 20th? They want to be in their hospitals, in their communities, and in the houses of our patients, caring for our patients. We never set out to do what we've done. But unless we have the issues of pay addressed, we are going to continue to drain nurses out of our profession, and we're going to continue with the crisis in the health service.
And you're going to continue to take industrial action. Could that industrial action then continue into the new year? And could you join it up with other members of unions, other workers represented within the health service?
No, we've no plans to join up with any other union. My mandate is from our nursing staff. Over 320,000 nurses took part in this ballot. That's a very significant group of people. So my concentration and the Royal College's concentration is on those nurses, and we'll continue to do that. You've asked me, could it continue on? The saddest thing after today's meeting, I think it will.
And what about any more talks? Nothing in the pipeline?
Well, certainly that wasn't the tone of the meeting today. But again, I would say to the Secretary of State, if he's listening this evening, my door is wide open for serious talks about pay. If he doesn't want to have those with me face-to-face and on a one-to-one, let's go through conciliation. But he has to move his position.
But just to be clear about that, if you're calling for conciliation and serious talks about pay, you've got an offer out there, you are prepared to negotiate on that, to come down a bit.
I have said time and time again, let's get to the table and negotiate face-to-face, not on the airwaves. We won't do that. But today was an opportunity that the Secretary of State has significantly missed.